Hey friends, how we doing? Ryder Champouillon, Point of Life Acupuncture, coming to you with another one of our What to Do Wednesdays. This is the episode or the day of the week where we have our episodes regarding your questions. Some of the questions I've received throughout the week, either live in my practice at the gym or over the online internet sources. And I give you some of my best answers to the questions that I've been hit with this week. And of course, feel free to ask some questions yourselves if you're in the room. If you're watching this right now, drop a message. Let me know what your questions are, and perhaps maybe I can give you an answer on them. I'd love to try to help you guys out. As you can see today, I'm sitting outside of my house trying to get a little bit of fresh air. You may see the puppies running around in the background. You can see my little pond over here as well. Certainly needs to be weeded a little bit. There's a little Buddha sitting under the tree. Got some moxa growing as well, some lily pads in there too, so it's a nice day. Figured I'd come outside and enjoy a little bit of the weather while I could today. So our topics today, we got some pretty interesting ones. Making babies, a big topic in the office. My poor fiance hates it when I come home and say, yep, I made another baby in the office today, but maybe not be the way that you think. But acupuncture is great for helping fertility issues. Also, too, what else is on the topic today? Carpal Tunnel Syndrome. I had a couple questions about Carpal Tunnel Syndrome this week. And the third topic, I believe, was, the pain to healed ratio. What's the expected time from when pain sets in, goes away, to when it's actually healed back to 100% again? So let's start going right away with our first topic. Hey, Ben, what's happening, buddy? Miss Stark, how are you doing today? Good to see you both in here. Miss Jen Chase and LAC, wonderful acupuncturists from out in our area. Good to see you hopping in today, too. All right, so first thing we're going to talk about today is making babies. One of people's favorite topics. So, recently had some questions regarding acupuncture and what people call infertility cases. Personally, I like to refer them as promotion of fertility because I believe there are actually very few reasons to consider somebody infertile. And I think we want to start off with a positive mindset in all things, and the fact that we are infertile is not a positive mindset. So we start off by starting with those people and referring to their treatments as being promoting fertility. And what does that tell? We work on both men and women, success with both, yes, babies. Who loves babies? Babies and puppies. Two of my favorite things. Tacos also, but don't make a taco out of a baby or a puppy. Not good for business. So, a little inside joke there. So hopefully some of you will get that. But so making babies. Matt Kramer, how you doing? Miss Jen Claire, how are you doing today? Making babies. All of a sudden I start talking about making babies, and Matt Kramer pops into the office. What's going on here, right? So, guys. So, making babies, work with male and female fertility issues. Male with low sperm counts, low motility, of course, erectile dysfunction as well. Get fantastic results with that, and don't worry, we don't need to jab your friends down there. You can leave the sticks and berries alone, but we can certainly, between acupuncture, re-regulating the neurological and hormonal cascades in the body, help to get those things to function a little bit better, if you know what I'm saying. So we won't be poking things in your sensitive spots, don't worry about that. And certainly herbs, nutrition, diet, those are a wonderful, wonderful way to help benefit those issues as well. As for female fertility issues, a lot of things that go in. Female cycles are much, much more complicated hormonal cycles than men do. Ashley in my office is my number one specialist for that. She does an absolutely fantastic job of making babies. Kevin, I'm sorry to say, buddy, what can I do? So Ashley is absolutely fantastic. There's several different procedures that women usually typically come in conjunction with. Usually seeing fertility specialists, commonly IVF, IUIs, implantations, donor cells, all sorts of different things. And the gist of it really is, without going into technicalities of them, we're really going to start to look to regulate your diet and your hormonal cascades, make sure that the hormones are flowing the right way, get the blood reports from your doctors that are taking the labs, looking to see what your hormonal levels are throughout the different weeks of your cycle, regulating the menstrual cycle first, make sure that the body is in correct position and correct physiology to bear a child and have a successful pregnancy with little to no problems whatsoever. I know I actually have a couple people in this room who we've worked with on their pregnancies before, and I'm sure they could say that we've done some great magic for them too, typically reducing nausea, morning sickness, stuff like that, cramping, as well as lower back pain, knee pain, shoulder pain. Carpal tunnel goes into that a lot too, kind of unknown reason why that, and most people think, okay, well, carpal tunnel's linked to pregnancy paresthesias, but we don't know why. Something to do with elastin being released and the change in angles of joints and things, and that's really just it. It's change of diaphragm, organs dropping down, shoulder girdle changing angle, but also as the hips change angle, that's the angle in the women called the Q angle, which is the angle from the hips out to the feet and the pelvic width in that area. As that angle changes, the angle of the elbows change to match. If you look at a woman when they stand up, their elbows will bend out to the side like this. Typically, they don't have straight elbows like men do. That's because men don't have hips for our arms to kind of swing back and forth wise. Women have hips that stick out to the side, so their elbows actually bend in kind of an L shape there. And as the hip angle changes, the elbow angle changes. And of course, by changing the angle of the elbow, the two forearm bones change their angle, thus changing the angle of the wrist, and carpal tunnel sits in. So with that, we'll make our transition into carpal tunnel syndrome. I've had a ton of success treating carpal tunnel syndrome. That's a crimping of the canal. The median nerve comes down through the hands. Scary, sad story about that. I had a client a long time ago who had carpal tunnel release surgery recommended by her neurologist, came in, and after 6 months of seeing some physical therapists, had absolutely no reduction in their symptoms, in fact, worsening of the numbness in their hands and fingers. So kind of got called in on that one, like, what the hell do you think's going on, Ryder? And did a full neurological assessment and said, you know what, I really think you need to see a different neurologist. Set a referral up for her. So I checked, the wrist, the forearm, the elbow, in the bicep, brachial plexus, up in the shoulder, into the cervical region where the collarbone comes through, into the neck area, and all those areas for local impingement spots of the nerve complexes that come from the upper cervical spine. Really had nothing going on. It was all negative. Now this poor woman had surgery, had a bunch of scar tissue put into her wrist from the trauma of the surgery, and what we ended up finding out is, unfortunately, the woman had a lesion on her brain, just so happened to be on the the sensory section of the opposite hemisphere's upper hands. So, because you have a lower hand, that makes sense, but you know what I mean, upper extremity and the hands. So with that, thankfully she got caught. One time we had, yes, Sonia, I'll get to that in a second, yes. Sandra. Why did I call you Sonia again? Why is Sonia stuck in my head? Your name is Sandra. I don't know why. Long story short, we caught the woman having lesions in her brain on the sensory portion of her hands in the brain area. She was medicated, the lesions dissolved and resolved themselves, but she always had some numbness and tingling in her hand because of the surgery that was induced. So make sure you get a full diagnostic workup if you're having carpal tunnel syndrome. Typically what they do is they go and they cut the area open, take out the scar tissue, kind of like you were roto-rootering your toilet bowl pipes, and then sew you back up. And anytime you get cut open, you're going to have scar tissue. Like if it's a neck surgery, back surgery, or cut on your hand, whatever it might be, you're going to have scar tissue from that, and that scar tissue becomes a permanent thing if not resolved correctly. So what we typically do in acupuncture is we usually thread needles through that canal and chip away at the debris that's in there, the scar tissue that's in there, without creating more scar tissue. So we actually roto-root it without creating more scrapes and bangs in the area. A lot of other different things we do too, localizing the muscle, regulating the local muscle tension in the forearms, making sure that the structures are balanced out, because like I say all the time, form equals function. Round tires roll because they're round, tables stand because they have legs. You try to have a table stand with two legs, it ain't going to stand. If you try to have a tire roll that's square, it ain't going to be a smooth ride. So our bodies function optimally when they are in optimal functional patterns, and form equals function, right? Structure equals what it does. So a couple ideas what we do there. Also too, again, a lot of people come with carpal tunnel syndrome where we don't even need to treat their wrists and hands whatsoever. The problem actually lies in the shoulder. As the shoulder changes its angle in the girdle and starts to roll forward, all the neurology in that area starts to impinge and twist, as well as the muscles and bones change in their angle, and therefore you have structural changes downriver. It's like having a sewer plant upstream and trying to go fishing downstream. All your fish are dead because the toxins in the water way up the river. So we always look at neck and shoulder as well when dealing with carpal tunnel syndrome out there. Am I covering the microphone? I'm sorry, I got big fingers. Is that a little bit better? I think that's better. I had my hand on the bottom of the phone here, so probably my big old hand's fault. So we look for the symptoms upstream to fix things downstream as well, shoulders and wrists. Shoulders and necks usually being a cause of forearm and wrist misalignments as well too. So Miss Sandra asked a question, can acupuncture help ligament pain in the wrist? Absolutely. No, pain is pain, however it comes around. Pain is a matter of altered function. Pain is a dysfunction in the body. It is a painful functioning of the body, and therefore we got to change the form of the body. So any alterations in form is going to be an alteration in function, and that function is dysfunction, and dysfunction means dis-ease, and dis-ease means lack of ease. When that lack of ease becomes so incapacitating that it affects you you or the people around you's living quality of life, and ability to be productive, that disease is then classified as an illness. So, yes. Can acupuncture help ligament pain in the wrist? Absolutely. You know, acupuncture isn't all that we offer at Point of Life Acupuncture, although that isn't the name. Maybe I should call it Point of Life a lot of other things. But we use the 4 pillars of East Asian medicine, which is tool usage, manual therapy, as well as manual therapy going to ingestible therapeutics, as well as self-regulatory exercises. So within those 4 topics, I've gone into them in other videos, and I'll probably do another one about them soon. I don't want to spend too much time talking about that. We have a whole host of different tools to try to get your body to be back in its proper function, therefore it's the proper form, therefore its function is correct, and with proper function, then your form can maintain itself. So absolutely, Ms. Stark, if you want to come in, we will certainly take care of you. I'd love to help you and your hands out for yourself and your husband and the little one you got there. So it'll be my pleasure. Cindy, great to see you coming in today. Thanks for shining in. We just talked about baby making with acupuncture, how acupuncture can help IVF success rates go up from about 25% to 55%. So that's pretty statistically relevant for making babies, helping to regulate hormonal cycles for both men and women, how carpal tunnel syndrome arises in fertility cases, as well as how we treat carpal tunnel syndrome. And then the last question we're going to have today is going to be regarding how long after pain starts is the injury actually healed. It's a very simple thing. From the moment that an injury happens, that pain affects, until the pain goes away, that same amount of time again needs to be covered. So if you injure yourself maybe doing Murph this weekend and your back's a little sore, typically we would say, let's say a week goes by, the pain's gone away, it's going to be another week on top of that until pain is actually resolved and healed. The injury is actually resolved and healed. Just because the symptoms are gone does not mean that the tissues are completely healed in the area. And in fact, that's the area where most people do most of their damage and have the most increased injury risks. What about thickening the lining? Thickening the lining of my injuries? What are you talking about? No, you're talking about the lining of the womb, right? The uterine lining. Hey, Chris, how you doing? This is crazy that you can do live on Facebook. Yeah, I know. Modern technology is absolutely amazing. It's been a great resource for me to reach out to my fans and my clients and people out there, and helps make the community a little bit better place, share some of the knowledge I have in my mind. So those of you that don't know Chris, she went to school with me back in the day, over a decade ago, back in New York College of Health Professions. Local provider. I think you're still in the New York area too, I believe. I haven't been really following up too much. Hold on a second, I got a little battery warning coming up here. But yes, Katie, you are correct. We can help to regulate levels of luteinizing hormone, which thickens the lining of the uterus for the egg to implant and get nurtured and grow into a very happy little baby. So that is exactly one of the ways that we work on things. Again, you know, we get the blood work sent back from your doctors to us. You can either bring them in or have them faxed into us, and we go over them, and we make the womb a very happy room to live in. So yes, luteinizing hormone regulation and thickening the uterine lining. Bingo right there. You got that correct. Back to pain again. Pain. So most people actually injure themselves by saying, hey, you know what? The pain has gone away. My injury must be healed at this point. And being that the injury is healed, I should go back to full 100% activity. And that is not the case. For the amount of time that the injury originated from until the pain goes away, that same amount of time, typically, not always, is what's required for the tissues to actually heal. I kind of use the analogy of putting up wallpaper, or maybe doing a construction project with some rubber cement. Just because the paper sticks to the wall doesn't mean that you can start leaning on it and moving it around, because it will slide. The glue has not set yet, and you know, the inflammation may be gone, the pain may be gone, but the tissues are not at 100% back to the way that they were originally made. So you want to keep that in mind. Another really important fact with that also too is the whole idea of, oh, I warmed up and my pain went away. A lot of people come in, shoulder pain, knee pain, back pain, whatever it may be, and say, hey, you know what, my pain goes away as soon as I start to warm up. But then again, it comes back, you know, a half hour or so after I finish my workout. There's a very simple reason for that. The same nerve fibers that send the message for pain are the same ones that send the messages as to where your body is in time and space, kind of like the GPS signal of all your tissues, bones, and joints. So with that, there's only so much bandwidth, and the sensors for movement outride, they overrule the sensors for pain. And there's a reason for that. If you were burning yourself, very often, if you think about all the times you've burnt yourself, hurt yourself, typically you pull yourself away from the thing that's bothering you before the pain is actually acknowledged. You don't go, oh crap, hey, my hand is on a hot stove right now, this really freaking hurts. okay, let me pull my hand away now. Typically you go, whoa, let me pull my hand away. How? Crap, that was hot. And then the pain goes, oh, that hurt, man. And there's a reason for that. If a tiger was chewing on your leg, you don't want to let that keep happening. You want to pull that out of the danger area. So we have A fibers that are our nerve fibers, and they send the motion signals more readily and more quickly and more dominantly than pain signals. So for all those people that are out there that think they are warming up and their pain is going away because the area is getting warm, the joints are getting loose, blood's getting there, that's completely BS. You are just overrunning the signal, and you still have the injury, you still have just as much pain, your brain just isn't registering it because all the bandwidth on the cable is going to keeping track of where you are. And then typically after you finish your workout, somewhere around every 15 minutes the neurological system resets itself, and in that reset time is when you sit in your car. By the time you get home, you drive, and you get home from your drive, you get out of the car, you go, oh, it's back again, why does it hurt? Because your neurological system reset, the bandwidth's back to normal, you're no longer moving, you're not blocking that signal, and then the pain says, hey, I'm here, and guess what, silly, you didn't listen to me, and now you really effed yourself up even more. So for those of you that think you're warming up, that's the truth of that. Warming up does not necessarily stop your pain. It does, however, help prevent injuries for proper warm-ups. I'm not saying don't warm up, I'm just saying if you think that your pain is going away because you warmed up the joint, that is not true. My name is Ryder Champouillon. That was What to Do Wednesday. Check us out on Facebook. You can check us out on Instagram at Point of Life Acupuncture. Of course, my name as well. We have our YouTube channel. Definitely subscribe to that. Hit that little bell that's in the corner there. Ring that bell so you can get updated of all our new posts that come up. We got Fridays coming up. Move, Think, Feel Better Fridays, where I'm going to show you guys actualized tips on how to improve your body, how to move, think, and feel better. Wednesdays, we have, of course, What to Do Wednesdays. And Mondays, check out our Point of the Day, where I'll give you some things, get the cerebral fluid moving a little bit, kind of things to be mindful of, pointful of, and help improve the quality of your life. I'm Ryder Champouillon on Point of Life Acupuncture. Be well and live life fully.